Hello, good afternoon. My name is Jeff Rowbottom, and I'm here today as someone who's gotten involved in the fight against melanoma. I'm also proud to be a member of the board of directors of the Melanoma Research Alliance, or the MRA. Like most people who've had cancer, I was not exactly excited to become so directly involved in the fight. 4 years ago, I had a pink nodule on my knee. It was initially dismissed by my dermatologist as just a scar tissue from a mosquito bite. It later became larger, it bled, and ultimately, after pushing, they figured out it was melanoma. I knew nothing about melanoma at the time, but I figured out in a hurry that my perception that skin cancer was really not a big deal was definitely not entirely correct. Given how serious and deadly melanoma is, I'm fortunate to be with you here today. Had a lot of interesting experiences over the past few years in getting to know more about cancer research, and the way the healthcare system works. The things I've learned are definitely consistent with the themes of this conference, that the patients, including myself, are becoming more active, driving change, wanting information, and pushing for changes and more rapid progress. Even the organization that I became a part of, the MRA, is really a patient-focused organization. It was originally founded by Deborah and Leon Black after Deborah was diagnosed with melanoma, and when she looked around and saw that what was being done was going way too slow. It was assisted in its formation by Michael Milken, who had battled prostate cancer himself, and his own father had passed away of melanoma. The MRA, like some other organizations, has a real model of collaboration, changing the way that cancer research has been done, backing the most promising, both proven and up-and-coming researchers. This has really led to a dramatic change in the treatments of melanoma. And if you know anything about melanoma, it, until recently, has been extremely grim if your melanoma progresses, and there was really limited treatment options. So it so happens, because some of the traditional treatments in cancer weren't working on melanoma, they had to go in a different direction, and they took it toward immunotherapy treatments, treating your immune system that would then in fact treat your cancer. And really, even in the course, the MRA has only been around since 2007. There's been enormous change, as many of you know, in the field of immunotherapy, and not just for melanoma patients, but also for other cancers as well. And I've really learned that patients, on one hand, you could stand back and not get involved, but even in very small ways and big ways, patients are really key to the ecosystem of healthcare and making changes and, in fact, making differences in individual lives. And change is really done in increments by single people accomplishing things. And this conference obviously has a number of folks who've accomplished a lot individually and together, tremendous things. So in my own industry that I work in leverage finance, there was other people who had been impacted by melanoma and just in general in cancer. So the industry came together in supporting the MRA. We raised money, but we also, education was a big part of it. Hundreds of people have gotten educated, gotten skin checks, and we raised over $2 million to fund research, a lot of it along the lines of immunotherapy, and even individual lives along the way have been saved. So people who've gotten skin checks, who've identified melanoma early. But one amazing example that, again, was just connecting the dots was a friend and colleague who's a financing partner at Simpson Thacher, James Cross, who works on all our KKR financings. He got educated through this MRA event, learned about all these new treatments, and again, a lot of them not well publicized at the time. They're in clinical trials, and hard to necessarily get all the information. He had a childhood friend from Virginia, Rusty, who had very advanced melanoma and had all the old treatments that hadn't really worked. And he convinced him to come up to Sloan Kettering to meet with Dr. Jed Walchuk, who was just starting an early first-time trial of combining one immunotherapy, ipilimumab, that had been FDA approved, with a new one in development called anti-PD-1. And notwithstanding what would seem like hopeless cases, and Rusty being one of them on the trial, within weeks, miraculously, Rusty's tumors just melted away, and by the spring, he was skiing out west with the Cross family, and he's now since returned to work. So it's a real eye-opener to me about the power of the individual patients. Rusty's story is not unique in this trial or others. You can read about it on the MRA website in more detail. I've also found getting to know the people who are actually in the trenches. I've gotten to know researchers and the doctors and what they do and the work they do with limited glory or even financial incentive have produced amazing breakthroughs. And then also gotten to know a lot of patients, and going into clinical trials of drugs that have not hardly been used in human beings is definitely something that takes some bravery. So in closing, just because I feel like someone out there may not know much about melanoma, I would just highlight to you it is a form of skin cancer. If you catch it early, it has an unbelievably high cure rate. And although we have treatments that are now developed, it's still extremely serious with a lot more work to do. So melanoma is a cancer that presents itself on the skin, and you can easily catch it generally by going to your dermatologist regularly, keeping an eye on your own skin. If you see something on your skin, please don't wait, get it checked out. Finally, use common sense in the sun. Wear hats, sunscreen, protect your kids who are most vulnerable, and even my daughters who hate getting slathered in sunscreen, you still gotta do that. So thank you for your attention.